Welcome to the Perfectly Planted podcast, where we are dedicated to growing with you on your journey to a healthier, happier, and more sustainable lifestyle. I'm Dr. Daphne Bascom, your co-host and superhero vegan extraordinaire. Vesime, how are you doing? It's good to see you.
Good to see you too, Daphne. I'm doing great and really excited to round out another episode of the menopause series that we've created, where today we're really going to focus on heart health, which I know some of you may be thinking, what the heck? We're talking about estrogen levels. We're women. We're not, our hormones are changing. What could heart health possibly be part of? And I know that I had the correlation. I did not make the correlation when we first talked. And so I thought, Daphne, this would be a great topic for us to cover and continue to dive into a little bit more. So that the key is really longevity and living our best lives.
I would agree.
So listen, for women, based on the AHA study, heart disease really is a leading cause of death in women in the US specifically.
Yep.
So what I really want to understand is, what is this link between heart disease and menopause? And maybe we could dive into that a little bit more, but let's start there.
Vesime, this is a very important conversation because I think that we forget that cardiovascular disease, as you said, is still the number one killer of women in the United States. And the link between menopause and heart disease is largely related to our beautiful friend estrogen. She is beautiful because estrogen does so many wonderful things in our body. It is protective, cardioprotective when the estrogen levels are high. It is anti-inflammatory when the estrogen levels are high. It helps maintain the flexibility of blood vessels. It supports healthy cholesterol levels. But when the estrogen levels decrease during menopause, these protective effects diminish. And this can increase the risk of heart disease to the point where post-menopause, the risk of heart disease for women, it becomes a great equalizer. During premenopause, perimenopause, our risk of heart disease is lower than men. We start to get to that equal risk as we move into postmenopause.
So I guess, what are some things, I guess I should ask, really can strengthen our heart health as we continue to age? I know that, just to recap from our prior episodes, we just finished an episode on muscle mass, and how that's so important specifically for bone health and continuing to live our lives the way we want to live. But what about the heart health? What are some of the things that we could do to strengthen that?
Let me take a step back. Let's talk about heart health, strengthening our heart health, but also let me make sure that we share how to assess your risk, because where you are premenopause may not be where you are today. So things that can happen as estrogen decreases during our midlife transition is that your low density lipoprotein, your LDL cholesterol, can increase. So this is a public service message to everyone listening. If you haven't had your annual physical exam, you need to know your numbers. And we talk about this a lot, know your numbers. So the reduction in estrogen can result in an increase low density lipoprotein, which is the least. It can increase your LDL, which is the
lousy.
Yes,
Being lousy.
I like lousy. Yeah. It can decrease your HDL, H being healthy. You may notice that your blood pressure goes up. If you are able to have a blood pressure monitor at home, making sure that you monitor your blood pressure, not just once a year when you go to the doctor, but measuring it intermittently at home is a great way of understanding where you are at any point in time. Estrogen also is anti-inflammatory. So we talk a lot about systemic chronic inflammation, and those declines in estrogen can result in increases in inflammation. So having blood markers like your high sensitivity C-reactive protein, your homocysteine level, they may be things that you can monitor over time to also assess your level of total body inflammation.
Mhm.
Other thing, and we've talked about this on a prior episode, is the change in body fat distribution. So going through menopause, you may go from a pear shape to more of an apple shape.
Mhm.
And that apple shape may also be associated with increases in your visceral fat,
Mhm.
which,
Yeah.
yes, is also a risk factor for not only cardiovascular disease, but I would say cardiometabolic disease. So it
Right.
may put you at an increased risk of type 2 diabetes, insulin resistance, other things that we've had conversations about and are important to your overall heart health.
And visceral fat, just is that fat around your organs, really?
Visceral
Yeah.
fat is the fat that's around your body organ. So it's not the stuff you can pinch on the outside. It's the fat that you can't see on
Mhm.
the inside. It's best measured. You can, if you get a DEXA scan, a dual X-ray absorptimetry scan, which most women are familiar with from doing a DEXA for bone
Bone
scan,
density. Yep.
but you can also do it for a body composition, and you
Mhm.
can get a estimate or a baseline of what your visceral adipose tissue is there. You can get it with an MRI, a much more expensive and less commonly used test. But if going through menopause, you did notice that shift from your hips to your belly, your visceral fat may have also increased.
Mhm.
Getting back to your primary question, so that's how do you figure out your risk? Am I at risk? And I would say that every woman going through menopause is at risk. It's
Mhm.
understanding what your risk profile is, and
Mhm.
including that on your family history and other conditions that you may be navigating. To strengthen our heart as we age are all the things that we talk about in terms of the pillars. So movement is key. You need
Mhm.
to regular exercise, whether you're looking at the US recommendations for 150 minutes of moderate intensity aerobic exercise a week or 75 minutes of vigorous exercise, which may seem like a lot. The key is to move, even if that movement is walking 5 to 10 minutes a day, but you have to move. You need to have a healthy diet. So your nutrition is key to your heart health, and food carries information. So including lots of fruits, vegetables, whole grains, healthy fats are another way that you can help protect your heart health. You want to maintain a healthy weight. So if the scale is creeping up as you move through perimenopause into postmenopause, you want to find ways to either maintain a healthy weight or move towards a healthy weight if you are currently overweight or obese. Meals, movement, mindset. I'm going to put mindset and stress together. So, stress management is key. And most people don't think about it as an important part of maintaining heart health, but chronic stress can negatively impact heart health.
Mhm.
And so, mindfulness, meditation, yoga, deep breathing. Leif and I recently did a podcast on mindful breathing. Incorporating those as part of a heart healthy routine can be key. Sleep. I can't speak enough about sleep, but making sure that you are getting adequate sleep. And then I would add in, if you are using alcohols, if you're smoking, even vaping, I would revisit the importance of alcohol as part of your healthy nutrition. And if you're currently smoking, I would strongly advise you to quit smoking because it is a major risk factor for heart disease. That was a lot.
It's all very important, Daphne. I think it's still the same pillars, movement, mindset, sleep, rest, recovery, stress, de-stressing your life. I mean, really all the things that we've really been talking about for some time now, but associating it to, the heightened awareness as within menopause, within the various stages of menopause, especially as estrogen is reduced, it just becomes much more important to manage some of these aspects of our lives. And I think I want to dive in a little bit deeper with what the specific link is between heart health and sleep. Because I think that we talk about it a lot, but I think the stress factor comes into play, especially if you're advancing in your career or other factors. Also, alcohol plays a big factor. If you are drinking alcohol or celebrating or whatnot, that could impact your sleep. And so, what are some of what's that link between sleep and heart health?
That's a great question. And let's unpack a couple of things that you just said. So first, and we probably need an episode on alcohol, but alcohol does not improve your sleep. And I don't know. So I would encourage you if you don't know how much you sleep, and it's not just the quantity of your sleep, but the quality of your sleep.
Mm-hmm.
So I have two devices that I'm showing. I wear an Oura ring and I also have a Whoop band. And they were instrumental in making me realize that I wasn't going crazy, that my sleep, you go to bed, but your sleep may not be as peaceful as you think it is.
Mm-hmm.
And even though I'm far post-menopause, I still have nights when I wake up drenched. I get out of bed, I towel off, I go back to bed. Those nights aren't the most restful nights.
Mm-hmm.
So I've come to better understand my sleep quality and my sleep quantity. But alcohol, if you're coming home from a hard day at work and you're de-stressing with a glass or two or three of alcohol, thinking that it will also help you sleep, it may help you fall asleep, but it does not help you get a good sleep.
Quality.
The quality is not there. No.
Mm-hmm.
So just wanted to touch on that in case I forget. So poor sleep, there are plenty of data to correlate the quality of sleep with maintaining overall cardiovascular health. And it's tied to blood pressure, inflammation, blood sugar regulation, reducing your risk of obesity. It's also related to making sure that you are getting the adequate recovery you need, because sleep is there for a reason. Mm-hmm. And it's funny that the menopause mastery class that I taught yesterday, we actually talked about sleep and stress. Mm-hmm. And the 50 to 60% of women going through menopause report sleep disturbances. Mm-hmm. And there is also a significant correlation between poor sleep and increased risk of cardiovascular disease. One other thing that came up, which was interesting just in talking to the women in yesterday's class, is the risk for obstructive sleep apnea. So it's not something we talk about frequently with women. Mm-hmm. I think that in particular, we tend to think of obstructive sleep apnea with men with big necks or who are overweight, but it can also occur in women. And there were 3 women who attended yesterday's class who've recently been diagnosed with obstructive sleep apnea. And OSA, obstructive sleep apnea, untreated can also increase your risk for cardiovascular disease.
And is that because of the lack of sleep quality? Because sleep apnea is in the way, maybe the breath, or what is it specifically?
It's tied to both sleep quality and then also, depending on the severity of your sleep apnea, when during those periods of apnea, your blood oxygen concentration is going down.
Goes down.
Mhm. And that can negatively impact your cardiovascular health and your brain health.
So it's interesting because you would never correlate sleep with heart health. People think about it mainly like diet, weight, lack of physical activity,
Mhm.
but rarely ever sleep. So it's fascinating to learn more about that.
But those two, so diet and weight, may also be linked to sleep.
Mhm.
So if you think about it, the nights that you don't get a good sleep, what are you like the next day? You've got the munchies.
Yes.
So poor eating decisions may also result from poor sleep and poor sleep habits. Um, you you may be more you may be less insulin sensitive when you're getting poor sleep than you are when you're getting adequate sleep.
Mm.
So I think that your because the other thing that sleep impacts, and I can't remember if we've touched on this in a prior episode or not, your hunger hormones, your leptin, your ghrelin are impacted. There, there are, sleep is really complex. It's not
Mhm.
just that we go to sleep and we wake up, but there are lots of things that are going on from a hormone perspective, from a inflammatory perspective, from a body repair perspective that makes sleep very important.
Mhm. So let's talk about some key tips to incorporate in our daily lives. And maybe we could focus in general and then specific to sleep, because I think that you've mastered a really good routine in the evenings to ensure that, you know, to ensure you get a good rest. And we talked a little bit about, through the vegan gym, menopause mastery, but also specific to your podcast with Lef around mindful breathing. I mean, some of these things all must be aid in good sleep, or, if as long as you're uh, exercising them throughout the day or right before. So let's talk about some key tips that you would recommend, Daphne.
Vesime, I think the biggest let's break it down into into navigatable chunks.
Okay.
Um, the first thing is establishing a routine,
Mhm.
meaning having fixed times for you to go to bed and wake up, and that
Mhm.
are to the best possible, to the best extent possible, that you do that 7 days a week, not thinking that you can sleep deprive yourself 5 days a week and that you're going to catch
Mhm.
up on the
On the
weekends.
weekends.
Yeah.
Yeah.
That used to be how I thought about it,
Mhm.
but establishing a bedtime and a wake up time really has been beneficial to my physical health and my mental health.
Mhm.
The other thing is a wind down routine. So setting an alarm, I don't always adhere to it, but I have an alarm on my phone that one, it shuts down my notifications at 7 p.m.
Mhm.
So I stop getting notifications on my phone. I have a reminder at 8 p.m. that it's time for me to start to wind down, which for me means turning down the lights. I try not to eat after 7 p.m. in
Mhm.
the evening because I sleep better when I don't have a significant amount of food later in the evening. Maybe it's time for some mindful breathing. Maybe it's time for some tea. One thing I've been doing consistently for the past several months is that I have one of those higher dose sauna blankets,
Mhm.
and I get in there 30 minutes before I go to bed every night. And usually I fall asleep in it.
Mhm.
So I set a timer, but finding some consistent way to wind down every evening, I think is very important because it prepares your body to wind down.
Mhm.
So a good night's sleep is a combination of eating healthfully and not eating too late, staying physically active, which can help you get ready for a good night's sleep, finding ways to de-stress during the day, whether it's mindful breathing, whether it's getting up and going for a walk, having a clear wind down routine so that you establish boundaries in your life for it's time for me to turn off my brain and my body and get ready for bed. Having a wake up a fixed wake up time so
Mhm.
that you're consistently trying to get up within, 30 minutes or so of a consistent time every day. Those are some of the tips that I would say I would I would advocate for people to start to adopt.
And I think that these are tips to help sleep much better, but also these tips are also aiding in heart health, a better
Yeah.
heart health throughout your life, throughout the days, the weeks, the years, the months. So I think that that's what's so important is that, what you're doing to help have a good night's sleep, which sleep is so important, is also helping over the overarching increase in heart health for you specifically. So I think that that's so important. And I love how we link the two together. And also, it's almost like chain, that it's like linking of a chain. They're all linked together, and they're so important. So I would also love to learn, a little bit more about, sorry, what we want to know is really what's one key takeaway that you want our listeners to understand today.
Mhm. Um,
And primarily in order for them to maybe make a small tweak that will essentially become make a larger impact in their lives, or maybe they continue to build on that small tweak. Because I think sometimes when we think about changing, it's a lot to change
Mhm.
at once. And making a small step is more encouraging to then make another small step to lead us to there. So what are some things that you would recommend as just something that we can incorporate where it's not going to be such a drastic change, but more of an encouragement to make more changes?
Vesime, I think the most important thing you said is that small, tiny habits, small
Mm.
change. So if I had to encourage our community to make one change today, I would say it would be add more plants to your plate
Mhm.
because nutrition is foundational for everything we're talking about. Um, your heart health is in your hands. While we're talking about menopause, we're talking about healthy aging. Yes, these can increase your risk of heart disease, but if you adopt a holistic and proactive approach to your health, it can make a significant difference.
Mhm.
And you can start by looking at what you're eating every day, what you're putting in your body, because your food is fuel, your food is information, and your food can be medicine. Because
Mhm.
eating more plants, it can help lower blood pressure, it can help get a healthy night's sleep, it can help more phytoestrogens, may help navigate some of those changes that we're experiencing as we're going through perimenopause and postmenopause. So food is key. And if there was one thing I would ask people to do, that would be it. Embrace a lifestyle that adds more plants to your plate. I'm not
Mhm.
asking you to take anything away. I'm asking you to add.
Yeah.
The other things, depending on where you are, would be movement. Regular physical activity is also key for your heart health and it's key for your sleep.
Mhm.
And so linking those two together, and it ties back into bone health, it ties back
Yep.
into our last episode on musculoskeletal health, which are also linked to nutrition, by the way.
Yes.
So movement is also going to be key. And making those two positive changes, if you think about what you're putting on your plate, and if you can prioritize moving every day,
Mhm.
you can protect your heart, but you can also protect your quality of life and make positive changes that impact your longevity.
I love that. No, I think that that's spot on, Daphne. If we're adding more plants to our plates, we're going to eventually and actually sooner rather than, later feel more energized to make that movement
We
change.
will. We will.
And then that movement change is going to improve our sleep. Then it's going to encourage us to continue to, grow and make the additional positive changes because we'll all feel better, I think. And all of this also helps with mental health, which I know is another topic that's near and dear to our hearts on that we've covered in the past. Well, Daphne, thank you again so much for another amazing podcast, a wealth of knowledge. Appreciate it. I love that we can educate our listeners and viewers on the importance of heart health through menopause as well. I want to thank our viewers and listeners also. If you're enjoying this podcast, please go ahead and hit the like button. Send us a comment, send us a note. We would love to hear from you. If you are enjoying it, please go ahead and subscribe and share with your families and friends and loved ones. And we all appreciate you so much. Be well, everyone. Until next time, we'll be together.